viewers. Welcome to the NASSCOM Product Enclave. My name is Sheela, and I'm going to be a moderator for the session today. I'm the ex-CEO with Vidal Healthcare, and I also sit on some of the advisory boards of Insure and health tech startups. Transforming home healthcare. Yes, that's a subject that we have today with us. And we have eminent speakers with us and who have been leaders in this industry. Home healthcare, which we thought once upon a time was a luxury. Today, it is a necessity. And I think during COVID, we had to have handled a lot of ailments which had to be treated at home, chronic ones. It's not only about buying an oximeter or a BP apparatus, but today it is about much more than that. We would like to welcome our panelists, and I would like to introduce them. We would, of course, move with the lady first, Aparna Pujar, CEO, founder, Zemplee, California. Aparna comes with 2 decades of experience in the healthcare industry, and she has had a lot of innovation, of which I'm sure she's going to talk about. Mr. Dileep Mangsuli, Executive Director, Siemens Healthcare. Mrs. Dileep comes with 3 decades of experience, and in the last 4 years, he has been working very closely and strategizing on affordable and digital healthcare. Amit Mohan, COO, LSCS and LSCS Digital Healthcare, LSCS is into life-saving devices, and Amit comes with 2 decades of experience and is also been an entrepreneur by himself and has been into the healthcare and banking sector in his background. So we would like to start the discussion, and I would like to start with the first question that is all about saying, okay, we've always had discussions on home healthcare, and Mr. Dileep, would you please specify what is the size of the market globally, what is happening, and what are the innovations?
Great. Sheela, first of all, thank you for inviting me to this meeting. Home healthcare, it's a very interesting thing. In last couple of years, I have seen this take even more prominence. We were always fascinated, and you also mentioned about home healthcare from being a luxurious or a need of people to a necessity now. I think this is a very important point because, from my point of view, I'm very fascinated by the affordable healthcare. In the long run, I've always felt that if affordability needs to be achieved, it has to be done with the goal of doing a screening or early detection or a continuous monitoring of health is what can actually prevent catastrophic healthcare problems. And home healthcare is one of those. Home healthcare is one of those areas which can actually help us actually bring in a great monitoring, great screening, great way of checking how the health of an individual is progressing. Healthcare, especially home healthcare, has been so far been focused on geriatric population. Geriatric population, as you know, is growing by leaps and bounds. Especially Japan has the highest number of geriatric people. India is improving in its health index, which means that we are getting more and more people who are getting older. And that actually is putting more pressure on the healthcare system. And if you think presently, the market size is around $34 billion, and it's growing at 26 to 27% year over year. The growth is going to be even more, according to me, because what we have seen, whether home healthcare can work, whether it is effective, whether we are seeing the outcome in a right way, was answered actually during the pandemic times. I, for myself, have seen during the time of pandemic, we opened it up for our employees to get the home healthcare, teleconsultation, and support at home and all that. And almost 95% of our employees use that facility. And this would not have been possible in normal circumstances. While Google was considered a good doctor, no one would ever, put themselves at risk not going to a doctor. But this has really grown in a big way. Uh, Teleconsultation, for that matter, last 2 years it has grown more than 3 times, and it is growing according to Niti Aayog in India itself. It's growing at 35 to 38% year over year. So home healthcare to me is here to stay. Home healthcare to me is also a way forward for affordability and precision healthcare. There are going to be a lot of new technology that will arrive. Monitoring of human body is not an easy thing, but there are new techniques that are evolving. There are new sensors that are evolving. Our wearables are a great example. Today it can detect a fall. Today it can detect abnormal heartbeat. Today it can detect, with a single lead ECG, it may not be 100% perfect, but it can indicatively give you a direction if you are moving in a right direction or not. Wearables being one of those things, there are going to be other technologies that are evolving. I can give one example is a digital twins. In Siemens, we are focused on actually developing a lot of digital twins of human organs. Today, we have a digital twin of a heart, which can help us in actually understanding if I need to place a electrode for resynchronization of heart. Where, if I place it, will it be a best way to manage it? We can do it on a digital twin and bring it on a real person. In the long run, we see this as evolving further, where one can actually monitor their own health progress on their mobile phones. All data is there. Everyone is picking data of whatever we do today. And that data, how do you bring it together into an understandable format and create an output for patients or healthy people? And in the end, I see this as a way forward for a wellness management rather than a disease management. Home healthcare, I will actually take it as a futuristic wellness management direction for us. So I'm excited.
Thank you, Mr. Dileep. Aparna, would you want to throw some light on this, what's happening in the US market?
Sure, yeah. So before I start, I actually have my background is all in technology. All my life, I've built technology product. And the reason I started Zemplee was primarily because I became a remote caregiver for my aging parents who live in India. I live in California and they live in India. And not knowing anything about the Indian healthcare market, I was so in tune with what was going on here. And my own challenges of taking care of them, especially as they were getting older, became a reason for me to quit my cushy corporate job of 20 years and start Zemplee. In the US, I would say the market is very, very diverse. So how's the US sort of just focused on the aging or geriatric, right? Broadly, it is all of Medicare. Most of it is Medicare, which is about $700+ billion market in the US. And it's very much structured the way the insurance companies and then the center of CMS, so the Center of Medicare or Medicaid Services, has structured care for the elderly. So as you all know, right, in the US, once you retire, your healthcare is covered by Medicare. So the government pays for your healthcare. And because of that, it's incredibly complex and complicated. Highly fragmented market, and the entire onus is, like Dileep was saying there, right, to get people to invest in their own health. Because in the US right now, I think the statistics are every day 10,000 people turn 65 and above, and that's the population that is hitting Medicaid on a daily basis, right? And that number is just growing. Also because the longevity has increased, right? People are living longer. They're also living longer with a lot more chronic conditions. So used to be that 4 chronic conditions was an accepted fact, and now post-COVID, they're adding a lot more conditions to this. And of course, COVID was a wake-up call for the entire US industry to focus on this industry. And for us at Zemplee as a startup, right, the opportunity opened up during COVID, ironically, right? And as a startup, we felt like we were at the right place at the right time, and telemedicine was taking off for a very different reason, that US was trying to prevent people from coming into hospitals. And as you know, the entire US healthcare ecosystem is structured around preventing hospitalization. So the less you bring people to the hospital, the more there is cost saving, because Medicare is funded by our tax dollars. And obviously, the way it has to work is, there has to be more people contributing it than more people taking out of it, right? But what happens is, as people get older, their care needs increase, and it's kind of like a reverse pyramid right now in the US, right? The population is, our mortality rate is actually decreasing, right? And then there are more younger people than older people in the US today. So it becomes a big challenge for how do we fund this system called Medicare or Medicaid, which is primarily taking care of the elderly people. Private pay is, so if you look at it, about 5% of the people kind of live in what is called as congregate care, which is care is provided under congregate living, which is through assisted living facilities or nursing homes. And the 90% of the people are private pay. And private pay in the US is very, very expensive. As you know, private pay is all about labor, and labor is expensive in the US. The math doesn't work out the same way in India, because I have people taking care of my parents in India, and it's like, oh yeah, I can afford that. But in the US, it's extremely expensive. So technology is needed to kind of, help balance that. I think right now, 85% of the not home health, but geriatric care is covered by the services market. I would say, there's no numbers on this, it's just my rough estimate. About 15% is what technology covers, and that's primarily through organized technology. As in, people are not buying tech. It's either provided by the healthcare system for you, or some doctor leases out the equipment, and it's still paid by the insurance. And when COVID hit, I think one of the biggest things that CMS did was they waived the copay for all of teleconsultation, whether it was telehealth or chronic care management. And so that was, I think it was something that they started primarily because they wanted to prevent people from coming to the hospital, and that was supposed to be, stop people from stressing out the hospital, because the healthcare systems were all under extreme duress during the COVID time. And what I would like to see is that remain, right? Because I think as the reports come out on the value of what telemedicine itself has provided, I think people will start seeing value in it. And somehow, like we were discussing earlier, right? Insurance is always reacting to the market, not proactively doing. And we work with a lot of payers right now, and we are kind of proving out some of the models for our own product, Zemplee. And hopefully, within a year, we will have some very data that is going to statistically show, how this has helped people age in place. So Zemplee's core focus is to help people age in place. And by that, I mean, there are two metaphorical meanings of that: age in place biologically, as in you continue to remain at your age where you are, which does require you to invest in your own health, take care of yourselves. And then physically age in place, which is essentially enable to create a system or an ecosystem in your home where care is sent to your home. So the big vision of the Zemplee is to create what we call a nursing home in the cloud. And that's what our focus has been. And to a large extent, it's still too early in the market, even in an advanced country like US, right? Because a lot of it is challenges with, especially in the geriatric population, adoption of technology. It's not easy. Having them to sustainably use it is not an easy thing. There are a lot of wearable companies that have come out, and they all struggle at some point of time. As people get older, you're dealing with a lot more issues like mental conditions, dementia, habit changing, right? Which is extremely hard to do once they're past 75. So our system kind of works in a very passive way, right? We actually equip homes with sensors. So there's no wearable, there's no behavior change required from people. They go about their own lives. And then Zemplee is kind of using an AI powered technology to monitor what they're doing. And we go all the way from health, well-being, and safety, because, in a geriatric population, the single most reason why old people get hospitalized is because of falls. So we do a lot of fall detection as part of our technology as well.
Yeah, sure. Thank you so much, Aparna, for throwing light on that. Amit, I would like to check with you on what would be the challenges that are there as far as the cost and affordability of home healthcare is concerned, and how do we, as organizations, plan to bridge this gap, especially since this is as of now not covered under the insurance for any of them.
Hey, thanks, Sheela. And I'd like to take the opportunity on behalf of G Healthcare to thank NASSCOM for giving us this opportunity. Now, before we go into challenges, I think it might be worthwhile to talk about what has been the drivers. And you talked about from the industry perspective. I think from the technology elements, industry is very well geared to take care of what is needed from the home healthcare perspective. I think they are a little ahead as well. In terms of what is needed from home healthcare perspective. As you introduced, like I'm responsible for the critical care life-saving equipment at GE, which typically involves anesthesia workstations, ICU ventilators, monitoring solutions, etc. But one of the biggest and the most satisfying part of my job is also around digital solutions, which includes tele-ICU, tele-ORs, remote ECG, tele-NICUs, etc. And during the pandemic, these are technologies which kind of acted as a force multiplier in a very, very resource-constrained environment. Actually, we all were seeing during the pandemic scare. The first wave hit us from nowhere. And we in the healthcare business, while we are responsible for saving precious lives and critical care equipment, we ourselves were very, very constrained. We are seeing this in our daily work lives. And I can say this with a lot of conviction that healthcare is set for a major transformation. It's already going through a major transformation, but it's nothing like what we are yet to see. And home healthcare, which has kind of become an integral part of wherever people have resources and they don't have affordability constraints and technologies are available with them, it will become one of the most important part of the healthcare delivery with no exceptions. Now, coming from the driver's perspective, and then I'll get to the constraint. It's important to kind of weave that story that way.
Sure. Yes.
As innovation and technology, I think companies like GE, Siemens, Philips, all of them, they have been doing what is necessity. In fact, GE way back in 2003-4 was talking about tele-ICU, and at that point in time, this was a concept which nobody could have even understood that actually. So the innovation and technology, the industry has been pretty much at the forefront of it. What changed during COVID times was the patient sophistication and the behavior, which I'll say would be the most significant driver from shaping this evolution is concerned. I think things like broadband connectivity. I mean, think of a home healthcare delivery without a maybe 10-15 years ago when we used to have to dial a modem router to connect to anything. It would not have worked. So I think while the industry has been ready, the ecosystem has also developed. I mean, I'll give you another analogy, not from a healthcare sector, but would Uber have been successful if Google Maps API was not there? No. So I think the whole ecosystem has, I will say that the whole universe was working towards it for us to be prepared. So the broadband connectivity kind of helped. Moreover, your smart point of care, what we call as the POC devices, there's a handheld, they are cloud connected interoperable equipment, and they work on the SaaS and the PaaS model. I mean, equipment which are able to speak with each other and can work interoperably among different systems. It's not that a G system is there and it will have to work on a G system. Today, the whole backbone of this technology is designed in such a way, and that's what we call as the interoperability, that any equipment, whether it's G, Philips, Siemens, any whatever we talk about, I think it can work on that particular backbone. So that interoperability also became extremely force multiplier there. I mean, these devices are able to aggregate, analyze, disseminate data for accurate and quick diagnosis. I mean, what Dileep largely talked about, precision medicine. Okay. And then we talked about teleconsultation. I would say teleconsultation happened and got a lot of, I would say, mind share during the pandemic times. But telemedicine as a concept, I mean, Dr. Devi Shetty's initiative, I mean, 10, 12 years ago, he was talking about it. He pioneered that with Karnataka government, India, with his hospitals.
To bring the rural into teleconsultation.
Yes, so it actually started there. But then was it a phenomenal model? No, because the resource constraint in a particular ecosystem or environment also enables that. But he was a pioneer of that particular thought process. So everything kind of came together. And then the last thing, what I talked about was the biggest force multiplier during the pandemic time was the patient sophistication, the health awareness. And while Aparna is there in California, but we did see a lot of reverse migration as well. And people started defining what is important to them from a work-life balance perspective, what element of work they are willing to sacrifice to have the right life elements into their daily living. So the reverse migration came in. The work from home became a good multiplier. I mean, earlier when you used to walk out the office, if there's the geriatric population got mentioned, you used to say, okay, I have stepped out of the house. They have set up a system. Those people, my parents or whosoever is old at home will be taken care of. And when I came back home, I get into that. Now, when you're working from home, you might be working from home, but you are constantly connected to that thing. Okay, is my father, is my mother being well taken care of? So that, and the proliferation of wearables, which Dileep kind of mentioned too. I mean, today you can monitor anything and everything from anywhere, actually. I mean, we have CCTVs at home and we monitor it like sitting on somewhere around the globe. I mean, the same thing is about wearables, where the data comes in. All these drivers were accelerated. I think people thought it as a science fiction movie element initially. Pandemic brought it into their daily lives. Okay, and hence the demand for critical care, preventive care, predictive care. I mean, there are different adjectives: personalized care, home-based care, virtual care, has surged. Now, coming to the challenges, I think industry is ready for this to provide that. The challenge is more regulatory. Okay, because anything which comes in also challenges the old system. It also challenges the mentality of the society as to how ready it is to accept it. Okay. When we talked about teleconsultation, we had doctors saying that, okay, our session will be recorded. I said, yeah, it will be recorded. And there are little hesitations to that as well. I mean, another analogy outside the industry is the Bitcoin industry. Okay. Everybody is excited about it, knows it will be part of our future. In what way, we don't know. But the regulation and the regulatory guys are figuring out how they can ease the whole thing into the whole thing. One of the things what we personally, and I personally saw it actually, was during the second wave of COVID in India. When home ICUs were being set up, and we GE worked with a few companies and startups to set up those home ICUs. Now, you can get a ventilator at home, you can get an ICU bed at home, you can get anything and everything at home, and you can create that isolated ICU at home. And what we did not foresee was that all our data has to be entered by somebody. Okay, he or she might be a nurse, low-level healthcare professional, but a healthcare professional is important to enter the data. At home, who's going to enter the data? And is that data entered by a family member? Will it be accepted from the caregiver or care assimilation or care understanding perspective? And then we said, wow, this is something which we have not thought about. Okay, and will regulation allow a family member to become a short-term transient healthcare professional? No, it cannot. They have to be super trained about it. So then the conversation, and I think that's a conversation which is still happening, that how can we make equipment intelligent enough to record it? They record it. Can they make the entry? So I would say industry is ready. It's more around the regulation. It's more around people accepting that data point. And also, I think understanding that it is not a flash in the pan thing. Everything, whatever you do, will add to the growth in the future. Like I mentioned the telemedicine earlier.
Yes.
So I think these are the pivot points, and we'll do well. It's only thing, and industry is ready from that perspective. But challenges are more external rather than internal to the industry at this point of time.
Sure. Thank you, Amit. As we discussed, with the geriatric population going up and assisted living being more of a concept that is actually catching up. So, are we experimenting something with the assisted living homes or anything? I mean, my question basically is, how affordable is this home healthcare going to be? And how are we seeing it? I mean, maybe at the starting point of it, the cost might be high, but could it be afforded by any of the children, I mean, who want to give the best care to their parents? Mr. Dilip, would you like to add to this?
Well, I think, the affordability is a very relative question.
Okay.
One thing Amit talked about, the technology piece,
Mm-hmm.
industry being ready. Well, there's one thing it always bothers me about home healthcare is the empathy factor.
Yes.
Many of the people get well when someone puts a hand on their shoulder and tells him that everything will be all right. You don't worry.
Yes.
Someone does
Yes.
that, then that actually changes the equation. It's not the technology, it's the empathy. It's someone, I had a case where there's one doctor. By just looking at the doctor, people would feel that I'm all right now. I just saw him and he just touched me and my 50% of the disease is gone. I think that is a piece that is going to be a big challenge. If I think about home healthcare, whatever technology we may prevent, unless we create a service organizations who are going to provide those people with empathy, it's not going to be a mechanical person who is picking up the digital data and making some decisions based on data points, but someone who is looking at the patient and giving him assurance, comfort, and providing that support. And that is an industry that needs to be yet getting ready. We are right now, I think if you look at it, the number of nurses that we have, number of doctors that we have is not enough. And for home healthcare, it's going to really need a lot more people who need to move into that. So I think from the readiness, from the service point of view, I'll still be a little worried. I think we still need
Rightly, yeah.
a lot
Mr.
of
Dilip
work.
actually rightly touched upon.
Can I add to what Dilip said?
Yeah, sure.
Sure.
Because my next question was going to be, since we faced a lot of manpower constraint, how are we planning to handle the home healthcare? Rightly touched upon. Thank you so much. Yes, Amit.
Yeah, Sheela. So Dilip is absolutely right. Okay, nothing can replace the empathy factor in a care. But
Yeah.
one thing what we observed, and we have data points around this, that maybe COVID kind of instilled that kind of a scare in people where they did not wanted to go to hospital, and they said if they can afford it, the home ICU part is like much more convenient. The convenience was not only about going to the hospital and not going to the hospital. It was also about that I'll be around my family members. Okay.
Yes. Yes.
So that kind of that is an added bonus and a plus point from a home healthcare perspective. That there's a suitable attendance of family members. You are connected. It's not that I only have a visiting hours from 6 to 8 p.m. and that's the only time I'll see, and I wait for another 22 hours to see them. I mean, they are at the beck of call. You are in the home environment, very comfortable. So that's right. But are they qualified HCPs? No. So that the suitable number of nurses and healthcare professionals to assist and be available from a home healthcare perspective, I think that's a necessity, and that's where also the regulation can possibly help. And then there's companies like who provide those nurses at home and things like that. That is a big ecosystem, again a part of ecosystem, but that part of the ecosystem also has to grow phenomenally. But again, external to the industry as such, from the technology perspective, technology and equipment perspective.
Yeah,
so
and
I have a completely opposite viewpoint on this, primarily because it's not like that in the US. I think in India, culturally, there's still that factor where the younger, like the adult son or daughter is
Yes.
taking care of the parents. It's in the US, it's not the same. Actually, parents live by themselves and children live by themselves. And, about 42% of working population have a remote aging parent. So, and unlike in India, perhaps as Amit was mentioning, where you had the opportunity to cohabit with your parents, in the US, it was exactly the opposite. Children were asked not to cohabit with their parents because of the risk that, the COVID exposure risk. So it created a whole bunch of social this a whole level of social isolation that actually impacted them more. To your original point about assisted living, right? Assisted living is a very organized industry in the US. Like I said, about 5% of 8 up to 10% of the people in the US live in what is called as assisted living, where it's all private pay.
Yeah.
And, it can cost, depending on where you are geographically, it can be anywhere from $5,000 a month to $12,000 a month. You have facilities that are sort of okay, affordable, to facilities that are 7-star with all the amenities, etc. This whole dream of giving you that ideal retirement lifestyle, right? That you're probably going to live for another 20 years. So get the best of what you can. And even in those facilities, right, they were kept isolated. So to your point, like when COVID hit, our technology actually came to the rescue of a lot of these families that were trying to stay connected with their parents in an isolated environment. And by isolation, I mean not just in the facility, right? Even within the facility, in the room, they were required to be by themselves and not mix with others, just to prevent the risk of or reduce the risk of COVID exposure. So empathy is a big one, right? And in the US, I think, there is no dearth of technology of what you can use. I mean, everything from Alexa to Google Nest to home monitoring system can give you all that technology, but that is not enough. Rightly, as both Amit and Dileep said, caregiving or caregivers are necessary. And in the US, it varies from, caregiving, not just on the medical side, but also on the home health side. They're called home aid. As in, if your father is living or mother is living alone, they need help around the house. They need someone to cook their meal. They need someone to wash their laundry. There's all kinds of things that kind of are required from if you look at the care as a 360-degree service.
It's a requirement.
Yeah, and then again, because it's labor intensive, it is very expensive. It is affordability is, I would say, the biggest barrier for anyone going to the industry. And even now, right after 2 years of a highly intensive, highly distressed environment, US is currently facing a huge labor shortage across any sector, whether it's organized nursing, clinical, non-clinical, and also home help, as they call them, right? And it's a very different system. I mean, home help is not like your typical maid who's coming in the house. It has to be someone who knows how to get old people out of their beds, put them on a wheelchair, wheel them to a bathroom, or wheel them to a kitchen. And it's a talent. I mean, it's not something everybody can do. And of course, there is risk involved. Like if this person is not trained and that person ends up getting a fall, they're back in the hospital. The insurance companies don't like it. The hospitals don't like it. And it's kind of like this vicious cycle, right?
Yep.
You don't have the right type of people to care for your elderly. That's where it starts. You're actually going to, become a sort of like a negative contributor to the healthcare ecosystem.
Yeah, I agree. It's a challenge.
Sheela, 2 footnote comments on what Aparna just said.
Yeah.
One is, I think the home healthcare thing, while it came into the foray in people's consciousness because of COVID, I think it's going to stay. This whole thing is not only about COVID or around COVID. So that's going to stay. Second is affordability is a relative term, as Dileep was also mentioning. Okay, the choice on affordability at that point in time was that I'm not going to get a bed in a hospital, and it's not only about economic affordability. It's also about the whole mental challenges, what you go through and the trauma you go through. Oh, I'm not getting a bed in the hospital. So the affordability is again a relative thing. So how do I put a cost to it? That's something which we'll have to figure out, and maybe the economists might do a better job around that. But home healthcare will live beyond the realm of COVID, COVID ecosystem and the COVID times we are living in. And second is affordability is at the time is basically what value I'm seeing in the price what I'm paying. So yeah, I'll leave it at that.
So yeah, like what I had said, it is now no more a luxury, but it is a necessity. And Mr. Dileep, any takeaway that you want to give our viewers, especially now that you've actually touched upon saying it could, we could have the digital platform, you could have the technology being there, you could have affordability challenges, anything, but empathy is something which cannot be replaced. So anything else that you would like
Well, I would basically say this. I think the technology is a backbone. We need that, right? Technology is needed, and also knowing where the problem is.
Yeah.
What I'm excited about is world adopted digital in last 2 years like never before. The acceleration happened, the catalyst, if COVID could be blamed for many things, but one thing you should really give credit to COVID is the digital acceleration, right?
Absolutely.
Indian government really pulled in this digital health stack policy. Now, what I'm excited about this new digital health stack policy is with the introduction of this, the data that is going to be available about everyone in the country who has one or other disease, their demography, their health condition, are they old, are they young, all the data will be available. Now, with this data being available, for technology companies to make it effective for creating a very good home healthcare system, you'll be able to do it much better. It's like Uber, right? You knew a Uber car is nearby, so you are able to order and get a Uber car pretty quickly. Now the patients are going to be here. You will set up your ecosystem around it so that you are able to serve the population much better. So with the availability of this digital health stack policy, home healthcare is going to take even better path forward. And with the other technology tools, one thing that is going to happen, whether we like it or not, is the engagement, co-creation, collaboration with different companies is going to happen, because no company has everything in itself. Siemens doesn't have everything. What Aparna does, we don't do. What we do, they don't do. And what we do, GE does not do in some cases. But what GE does, we don't do. And we have to come together, and this is going to happen, according to me. We have started working with startups. We have started working with universities. We have started with hospitals and different companies to bring in and create a technology as a combination. Each one of us have that one technology, when combined together, can be a world beater. And today's population needs it. If pandemic has taught us anything, it is to come together and serve the population rather than just trying to be focused on selling what you have. And I'm absolutely convinced about it. It may take a little time for everyone to realize that, but more we see the variants, new variant has come again, and more people will be convinced about this. And in a few years' time, we definitely will see healthcare will be much better, much impactful, and also there will be a support system coming from government, as well as I think insurance sector will also change. Home healthcare is here to stay, here to grow.
And home healthcare will also become one later stage of wellness healthcare. So with that, I would like to thank each one of you for spending your valuable time.
Great.
And giving our viewers and all of us the knowledge on healthcare. Thank you so much, and we'll stay connected.
Thank you.
Thank you.
Thank you so much.
Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye.